Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. So much focus lately has been on outdoor air quality, especially with recent smoke from Canadian wildfires. But what about indoor air quality, which mostly goes unregulated? Today, Dr. Gigi Gronvall of the Johns Hopkins Center for Health Security joins Stephanie Desmon to talk about a new framework designed to help states ensure there's clean air in schools and government buildings. Let's listen.
Gigi Gronvall, thanks so much for joining me.
Such a pleasure to be here.
So today we're going to talk about indoor air quality. I was reading that the average person spends 90% of their time indoors. And when we talk about air quality, we're often talking about outdoor air quality. So talk to me about why indoor air quality is important and why we aren't paying enough attention to it.
Sure. So outdoor air quality, we are very fortunate, is much better here in the US than many other places, and it's regulated. If you're a polluter, you could get caught. There are regulations in place that could stop you from polluting, but that's not the case for indoor air. And breathing is important. So it's really important wherever you are that you have clean air to breathe. And often in indoor environments, you just don't have ventilated, filtered air. And so people are exposed to high levels of pollutants, but also it increases your infectious disease risk. And so in the last few years, we've had a couple of big examples of both being problems. So, not just COVID, but RSV and flu can be something that you can share a little bit too much with your neighbors in indoor environments. And then the smoke, the Canadian wildfires really showed people that outdoor air can be polluted and then indoor air gets polluted as a result of that. And how do you purify those indoor environments so that it's healthy?
So what can we do about this? And what are you proposing?
We have worked with a bunch of experts from across the country to develop this Model State Indoor Air Quality Act. And it's really a legal foundation, so states can pick it up and regulate air the way that states regulate restaurants and food and things like that. So the idea is we are giving a framework for states to pick up, but they'll be able to adjust it depending on how much work they want to do to control indoor air environments. We are not talking about people's personal residences. We're not talking even about hotel rooms. We're talking about public buildings where you are going, where you maybe have to go, and you're sharing air with other people.
I guess schools are a good example of this.
Schools are a great example of this. And we saw the concern with COVID about wanting to make sure that there was filtered, ventilated air to breathe for our students. But it's kind of shocking, like decades of research that shows that healthy air will lead to improved test scores and better staff retention. We've been ignoring it for a long time, but it's not something we really should be ignoring, because if you breathe poor air, you're not going to do as well. You're not going to think as well. And there's been a whole bunch of studies about showing that not in school environments, but in workplaces, that people are more creative, that they're more productive if they're breathing good air. It kind of is obvious, I guess, because if you're in a stuffy environment that you don't think as well and you're sleepy, you don't work as well. There's data that backs that up.
And I guess it's something we take for granted. In many cases, we just assume the air will be fine.
Yeah, because most times it's not measured. So as part of this Indoor Air Quality Act, we provide a framework for how you should be measuring the air quality and then posting it, because most people just have no idea if they're going into a public building, they're going into a restaurant, how good is the air, unless you're carrying a device with you. And a lot of people do, but it's not everyone. And so you won't know that the air is unhealthy unless somebody tells you.
And unhealthy air contains all kinds of different hazards, right?
Yes. We got into this at the Center for Health Security. We got into this because of the infectious disease angle, because there's a whole bunch of respiratory pathogens that are transmitted airborne. So SARS-CoV-2 was one of them, but there's also measles, RSV, flu, and that's one angle. But there are a lot of other things that are in the air too that are really unhealthy for you. Everything from off-gassing from new upholstery, particulate matters, radon. So there's a whole bunch of unhealthy stuff that could be in the indoor air that filtering and ventilation can help address.
Would this be something where you would try to incentivize building owners to clean their air?
Yes. So there are incentive programs, and there's also a way for people to complain unhealthy air is not addressed. The framework that we're producing with this Model State Indoor Air Quality Act gives the state the tools to be able to regulate and to promote healthy indoor air. It's not something and it can adjust over time. So if there are better ways to measure indoor air quality, that those can be adjusted and put into the state's regulatory apparatus. It's more of a foundation, a legal foundation, than it is you must do this at this point.
So the federal government regulates our outdoor air. Why do they stop at the front door?
There has been a couple of decades of efforts to try and get the indoor air quality to match the outdoor air quality as far as regulation goes. And Congress is elected to not do that for a long time. Supreme Court decisions, I'm told, I'm not a lawyer, I'm told will affect the ability for agencies to do that as well. So it really goes down to the state level. And so that's why we want to give states these tools to be able to regulate the indoor air quality in their state.
Are any states doing this yet?
There has been some work, for example, in New York City and New York State. A lot of states have some indoor air quality measures, but it's really a patchwork, and they might just regulate radon, or they might regulate secondhand smoke or things like that, but it's not consistent. So that's one of the reasons why this might be useful for states, that it offers a way to regulate more than just one thing or more than one environment. So not just schools, but all public buildings.
I read somewhere that there are like from 2 to 5 times as many pollutants indoors as outdoors. That was really surprising to me.
Yes, and it's really unfortunate because we spend so much time indoors. You mentioned 90% of our time. It's probably higher than that. I read in a book that some people have compared it to the amount of times that whales spend outside of the water is greater than the time that humans spend outdoors. So over the course of their lives, we really spend a lot of our time indoors. And we all know there's a collection of reasons why air could be unhealthy. We know that asthma triggers are found everywhere, and we know that it has disproportionate effects on people who are minorities and tribal areas. We know that all this stuff, but we just need to actually do something about it.
Do you think there's the political will to do it?
I think it's going to be a challenge because it's not a cost-free act. I mean, it's going to cost a couple $100s per person. That ends up being billions of dollars. The benefits are greater than that. The health savings are greater than that, but it is going to be a challenge for some states. On the other hand, it's a matter also of education. People need to understand that air is important. We all know that, but we would not tolerate water that comes out of your tap that will make you sick. Why are we tolerating air that can make you sick as well? So it really is a fundamental change in how people perceive it. And that's why if there are some states that adopt this, I think it will raise the bar for everyone because it's really a no regret investment as far as people's health and reducing sickness and increasing their life expectancy.
You were talking about water regulation. Are there lessons to be learned from how that came about?
I think it took a while. I think one of some of the lessons from there is that it took a lot of evidence to show that it was achievable. And it took a lot of public demands to make that happen once people realized the connection between clean air and health. So, yeah, I think it's important. We wouldn't tolerate restaurants that routinely shut them down if they have unhealthy food. So this is an extension of that. Breathing is important.
Yeah. I guess with climate change, we're going to probably even spend more time indoors. It feels as though the urgency is really picking up.
I think, well, yes, climate change changes our urgency about many things, and we're going to have to deal with more infectious diseases as well because a result of climate change and also diminishing vaccination rates. There's a lot of reasons that we want to make sure the air is healthy. There's even national security interests involved here because there are a lot of people are interested in what can we do in a room to make it healthier to breathe, just in case there was an attack of some sort, a chemical or biological attack. How can you reduce the potential impact of that? There's only good reasons to do something about it, but it is going to be overcoming the inertia of not having done as much as we should have up to this point.
Gigi Gronvall, thanks so much for joining me.
Thank you. It's great to be here.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmon. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.